Welcome to We Take You Places, the podcast for international students at the University of Marburg. In this podcast, we dive into a variety of topics related to studying and living in Marburg and learn some helpful tips from experts, other students, and university staff. Stay informed, stay inspired, and make the most of your time at Uni Marburg. Let's get started.
Hi, my name is Alice, and in today's episode I would like to focus not so much on the university itself, but on how our healthcare system functions. Finding the right doctor, whether for when you are sick or just for medical prevention, can be a long and tough process. But I will equip you with all the information necessary to guide you through our German healthcare system. Number 1. Who needs health insurance in Germany? Health insurance is mandatory for all students studying in Germany. You can't enroll at a German university without proof of health insurance. If you are from the EU, Switzerland, or other eligible countries, you may use your already existing health insurance from your home country. Number 2. Public insurance versus private insurance. What's the difference? If you are a student from none of the eligible countries, which can keep their health insurance, you must obtain a German health insurance. Public insurance is the most common one, and prices can range from 130 to 150 euros, but can vary depending on age or provider. If you are above the age of 30, you can become ineligible for public insurance or have to pay more, often based on income. If you are over 30 or a language course student, private health insurance may be a more suitable option. Private health insurance also allows you to include additional benefits public health insurance may not cover. In general, the search for the right health insurance can be complex and depends on a variety of factors. Therefore, as private and public health insurance both have advantages and disadvantages, it's best to inform yourself about which health insurance suits you best. Number 3. How to find a doctor in Germany. To find the right doctor for your needs, it is important to gather enough information about doctors in your area. It's best to find a general practitioner, or in German called Hausarzt. These kind of doctors take care of the general well-being of their patients. Online, you either search yellow pages, where you can find a variety of doctors, or different websites which all list all doctors available in the area, such as Google Maps or Dr. Lib. Sometimes, the easiest option is to just Google Allgemeinarzt plus the city you live in, so for example Allgemeinarzt plus Marburg, and then to compare ratings. If you struggle to find a general practitioner, you can call the TSS appointment service at 116-117 around the clock. After a quick assessment, they will guide you to the right doctor. As your health and physical well-being is important not only when you are sick, the search for the right Hausarzt should start as soon as you arrive in Germany. Furthermore, even in case of necessary booster shots, a general practitioner can help you. Number 4. How can I make an appointment? After you have found the right doctor, you can make an appointment. Whereas some doctors may have the option to make an appointment online, it is most common to call or make an appointment in person. After asking the receptionist to make an appointment, in German you can say, Ich möchte einen Termin machen, they will check the calendar to find a day and time. If your matter is urgent, definitely mention it right away, but try to be as flexible as possible when it comes to the day and time of your appointment. And, if you are a working student, you can always ask your employer to delay your working hours to go to the doctor. Many general doctors also have open consultations for a couple of hours every day. Then, you don't need an appointment at all, and you can come to the medical practice directly. Number 5. What do I need to bring? The most important document to bring is your Gesundheitskarte from your health insurance provider. Otherwise, it can sometimes be helpful to gather important information about your own health before your first visit or even before you come to Germany. Often, on arrival, you have to fill out a sheet about personal information. Then it can be helpful to know when you had your last surgeries, which medication you are taking, or if there are other important information the doctor should know. Otherwise, you don't need to bring anything, except you're also of course allowed to bring someone with you, like a German-speaking friend, if you don't feel comfortable going on your own. Number 6. What can I expect when I visit a doctor? When visiting a doctor, your first point of contact will be the front desk. There, you will have to show your health insurance card and say your name. Then, if it's your first time, you have to fill out some paperwork. Then, you may sit in the waiting room until your name is called. Waiting times can vary, and sometimes are up to an hour. When it is your turn, the receptionist will take you to the consultation room. There, a doctor will assess your medical health. Even though German doctors are rather direct and not as shady, you are of course encouraged to ask all the questions you may have. At the end of the visit, your doctor may give you a prescription if you need medication, or a referral to a medical specialist. Number 7. What does it cost to see a doctor? If you have health insurance, it doesn't cost anything to see a doctor. But sometimes, depending on the prescribed medicine or the services provided, you may need to pay a small fee for the prescription at the pharmacy. Now that you know all the general information about German health insurance and how to plan your first doctor's appointment, let's talk about some more questions you might have. You will get an overview about what a Arbeitsunfähigkeitsbescheinigung is, when to go to the emergency room, and what other options than a general doctor are available in Germany. Number 8. When do I need an Arbeitsunfähigkeitsbescheinigung? You need an Arbeitsunfähigkeitsbescheinigung to confirm your illness. It's a note from the doctor you can hand in at your company or the university when being sick at an exam or in case of a longer period of sickness, if needed. Only then you can receive sick pay from your work. It's still important to keep in contact with your company and tell them immediately when you are sick. Number 9. When do I need to go to a medical specialist? Medical specialists, like cardiologists or dermatologists, provide special care if needed. You can either call directly to a practice or make an appointment online if available. Sometimes you require a referral from a general practitioner, and waiting times can be very long. Dentists and gynecologists can be visited without a referral and should be sought out every 6 to 12 months for medical checkups. Number 10. When should I go to the emergency room? In case of an emergency or a life-threatening situation, you should go to the emergency room or call an emergency vehicle which brings you to the hospital. Sometimes, even your general doctor may advise you to go to the emergency room. In Marburg, the emergency room is located on the Lahnberger within the Uniklinikum. Depending on your state, waiting times can be very long, sometimes even hours. So therefore, it is really important to only go to the emergency room if really necessary. In case of a mental health crisis, the Telefonseelsorge, a hotline run by volunteers with a special training, can be reached under the number 0800 111 0111. Otherwise, the university offers peer-to-peer support groups as well as psychological counseling services. If you want to learn more about mental health services in Marburg, give our podcast episode about mental health a listen. Number 11. When should I call an emergency vehicle? As the word already indicates, an emergency vehicle should only be called in absolute emergencies. This is the case if you or a person in need is not able to go to the emergency room themselves, or when a situation is life-threatening, like chest pain, difficulty in breathing, or confusion, or a change in mental status. If the situation appears not to be a medical emergency, the health insurance may expect you to reimburse them with the cost of the service. This could cost between 400 to 600 euros. If you are insured by public health insurance, the insured person has to pay an out-of-pocket payment of 10 euros, nevertheless, if it is an emergency or not. The number to call an emergency vehicle is 112. Number 12. What if I'm getting sick on a weekend? If you are sick on the weekend, at night, or during statutory holidays, there's a medical on-call service. You can find the doctors either online or by calling the 116 117. Then, an employee might assist you in finding the right doctor for you. The medical on-call service is the right option for you if you can wait until the next day to go to the doctor, but are not in a life-threatening situation. In Marburg, the medical on-call service, called RBD, is located near the Universitätsklinikum and is open from 7 p.m. to midnight on Mondays, Tuesdays and Thursdays, from 2 p.m. to midnight on Wednesdays and Fridays, and from 8 a.m. to midnight on Saturdays and Sundays. Number 13. How can a pharmacy provide help? At a pharmacy, the staff is trained to provide help in case of minor infections, such as a cold. They can give you a first assessment of your illness and can provide you with the right medicine. In case of a prescription drug, a pharmacy is the place to go with your prescription from your doctor. Number 14. Who can I contact if I need assistance about finding more information about healthcare in Germany? In Marburg, you can get help from trained and volunteering Gesundheitslotsinnen. The task is to help people with a migration background to ease into the German medical system. In addition, Marburg's voluntary agency organizes a monthly international get-together to which international students are invited. There, you can get familiarized with the city and the citizens of Marburg. Furthermore, the Service Center for Social Affairs offers an overview on social services and assistance. The service is located in the Irving Pescado House, and you can use the consultation hours without an appointment. Last but not least, the collective Prima Ärzte, an association of more than 400 doctors, offers an overview of all their medical practices online under the website www.primaeg.de. All the other links to the most important websites can be found in our summary.
Infobox.
In this episode, we explain how healthcare in Germany works. Here's a short list of the most important terms you need if you want to get the hang of the German healthcare system. Hausarzt. A Hausarzt is a general practitioner who is your first point of contact in case of an illness. Even if it is mostly common to keep your general practitioner long-term, you are of course able to change the doctor if you are dissatisfied or are moving. Furthermore, the search for the right general practitioner should start as soon as you arrive in Germany or move to a new city. Facharzt. A Facharzt is a medical specialist. Sometimes you can call them directly, but sometimes you need a referral, Überweisung, from your Hausarzt. Waiting times can vary and depend on availability and urgency, but can entail having to wait several months. Krankenversicherungskarte. A Krankenversicherungskarte or Gesundheitskarte is a health insurance card. It is a physical card with a picture of you on it, and it is necessary for all appointments at a doctor. Arzthelfer. A Arzthelfer or Arzthelferin is a doctor's assistant. Sometimes they may ask you questions about your health before you can see the doctor, and sometimes they assist while you're in the doctor's office. Sprechstunde. Sprechstunde is the German word for office hours. During those hours you can see the doctor. Sometimes doctors have extra walk-in hours for patients without an appointment. Be careful, some walk-in hours are not available for patients with respiratory illness or other easily communicable diseases to ensure the safety of all patients. Apotheke. A Apotheke is a pharmacy where you can buy pharmaceuticals and get your prescription drugs. Rezept. A Rezept is the German word for prescription. It can be a paper prescription or an electronic prescription. E-Rezept. After you receive the prescription, you can hand it in at your local pharmacy. Arbeitsunfähigkeitsbescheinigung. You need an Arbeitsunfähigkeitsbescheinigung, often called AU, for your job or when writing an exam. It is a note from your doctor confirming your illness. Kassenleistung. Kassenleistung is the German word for all costs covered by the health insurance provider. They include all treatments that are necessary in case of an injury or a sickness. All extra services and treatments such as voluntary vaccines or professional tooth cleanings are not included and must be paid out of pocket. This was another episode of We Take You Places, the podcast for international students at the University of Marburg. Thank you for listening, and we'll see you next time.